Hi, I'm Dr. Rudra Mohan and welcome to the Oral Health channel, where we are presenting you with the case of impacted upper and lower left wisdom tooth and teeth in a 19-year-old patient who developed pericoronitis due to chronic cheek biting and impacted teeth. And as you can see in the following pictures in the video, that we are giving the inferior alveolar nerve block because we are attempting the surgical extraction of an impacted 3/8. We will first attempt a non-surgical extraction of this, and as you can see, we are giving the inferior alveolar nerve block followed by the lingual nerve block, and then we will give long buccal and local infiltrations so that the patient can undergo the procedure of extraction without any pain. Now you can see we are using a number 15 surgical blade to lift and elevate the mucoperiosteal flap. This is used to gain access to the impacted tooth which is present, that is tooth number 3/8, and now we are using the blade to further extend the flap and retract it, doing the sharp dissection, which will be followed by the blunt dissection using the periosteal elevator. As you can see that there is a lot of bleeding because there was a lot of granulation tissue and we are suctioning the blood out. And if you can appreciate, you can see the impacted tooth that is present along with some food debris that was present there. Now we are using the periosteal elevator to start to luxate the tooth so that we can take it out. We were definitely wary of the fact that it might have to go for a surgical extraction, but we always try to go for a non-surgical extraction approach by using the wedge principles and the lever principles. And here we are trying to luxate the tooth out. You can see the tooth is there. We are using a point as a lever and a fulcrum, and then we are luxating the tooth out, and thankfully to our relief that this tooth wasn't going to cause us much problems, and the tooth was luxating very easily on its own, and the tooth has started moving. It has started moving in its socket and its alveolar bone housing. We are suctioning the field so that the oral surgeon Dr. Prabhat Sen can access the area and start removing the tooth. Now, while most of the tooth is out, we were very happy, but its attachment to the underlying socket was still very, very thick. We could appreciate a bulk chunk of periodontal and granulation tissue, and that's why the tooth wasn't coming out very easily. So we tried to dissect it out, blunt dissection, and we tried to remove the attachment apparatus of the tooth which it was connected to with the alveolar housing. And here you can see that we are trying to take the tooth out, and with the help of proper suctioning and all principles of oral surgery, we are just managing to take the tooth out, and we have finally taken tooth number 3/8 out of its socket completely. As you can appreciate, this is the completely intact impacted tooth, that was tooth number 3/8. Coming to tooth number 2/8, that was the upper tooth which was causing the cheek bite as well. As per the discussion with the oral surgeon, he said it was always better to take both the teeth out because they are vestigial organs, so to say. And we are giving the posterior superior alveolar nerve block along with local infiltrations. We also gave the greater palatine nerve block, which we did not record in the camera, but yes, we have given the greater palatine nerve block. And now we are starting to attempt the luxation of the teeth after the gingival fibers have been separated with the help of a periosteal elevator. And now we are separating further. We are going more apical to separate the fibers and try to raise the flap and elevate it, and then we will try to first attempt the non-surgical extraction, knowing that the teeth were impacted. And now we have started luxating the tooth. We've placed the elevator between the two teeth, and now we are using principles of oral surgery exodontia, where we are very carefully but with calculated force, direction and angulation, we are trying to shimmy the tooth out. The patient is not feeling any pain right now, only pressure, and we were speaking to the patient while we were doing the procedure that if he is feeling any sort of pain, and the patient said no. Now you can appreciate that the tooth has actually come down, it has luxated out, it's come out of its socket but not completely. So we will further luxate the tooth out, and if required we'll use forceps to retrieve the tooth out. And Thankfully, the whole tooth came out, and now you can appreciate both the teeth 2-8 and 3-8, which have been taken out in a matter of 9 minutes by our oral surgeon, Dr. Prabhat Sen. And this has been a very fruitful video, because with the right principles you can avoid all possible complications of surgical extraction. Yes, since we had opened and raised a flap, we will give sutures, and these sutures were removed 15 days after the procedure, and the patient has been comfortable ever since without having any issues regarding the area of operation. This is me and Dr. Prabhat Sen operating on the patient. Thanks for watching.